Ryan was diagnosed when he was 2 with autism. His speech is delayed and his social skills have been delayed too.
Zoe's been diagnosed with sensory processing disorder. She has issues with listening and issues with touch.
They were born about 14 weeks premature.
Carolee was born with Down syndrome, and at birth they also discovered that she had a heart defect.
Simeon was diagnosed with PDD-NOS, pervasive developmental disorder, not otherwise specified.
Micah was diagnosed with PDD-NOS, just as Simeon.
These children face challenges ranging from simple to complex. Yet, for individualized therapy, parents and physicians choose the same place: Witwer Children's Therapy.
Witwer Children's Therapy Center is an outpatient program for children. We provide physical therapy, occupational therapy, and speech therapy for kids. And we're part of the Physical Medicine and Rehab Division of St. Luke's.
If we look at a child developing from the beginning, there's certain things, milestones that they should do. If they're not attaining those milestones, whether it be motor skills, learning skills, speech skills, then there's oftentimes a need to try to figure out why that is, and if there is a problem, then where we go with that.
You just keep hoping that the language would come. And we had, in our family, we had some late speakers, some people who didn't speak until they were 3, so of course, you know, oh, they'll speak, they'll speak.
Ryan was basically almost nonverbal. He wouldn't interact with anybody. He had a lot of meltdowns, which at sometimes were quite violent.
The anxiety started to get really prevalent, and we would notice that if she was in a line or if missed her place or if something was bothering her, that she really started having issues with that. She just wasn't doing what the other kids were doing.
I would be vacuuming, and behind the blinds for the big door would be maybe all the blue toys. To be doing that before 1 year, you know, we just knew that something's not quite right.
One of the problems they had early on was just a lack of upper body strength, a lack of kind of core strength, awkwardness, clumsiness, falling over. And so the occupational therapists at Witwer have really worked on developing that core strength, developing the upper body. We've just been amazed at some of the transformations in our children.
The work of children is play. So when they come to therapy, if it's not a fun place to be, if they don't think they're coming here to have a good time, they're not going to learn. And so we try to make this as kid-friendly as we can.
Our therapy is based around play, so it doesn't necessarily look like traditional therapy that you would see just in a typical adult PT clinic. We use toys and balls and mats and swings, and you know, we're able to make it that functional play to work on strengthening and balance and those type of activities.
Zoe's response to therapy has been amazing. The change it's been unbelievable. And when we first started coming, she really resisted it. Now she's excited to come, she looks forward to it. Her response has been terrific.
When she first came home, she wasn't very mobile, and she's blossomed into a toddler, as she should be now. It's a joy to see.
They're very fun people. They're made to work with kids. I think that they always have sort of a plan in mind of what they're going to do, and you know, they involve us as well.
We have to show parents how they can embed the techniques that we're teaching them into their day-to-day routine so that it becomes part of everyday living for the kids, and that's how improvement happens.
What I see in the parents when, you know, the child is making some nice improvements or has done something in the therapy session that they haven't been able to do before, I mean, there's a lot of emotion involved in it. Maybe it's something as simple as tying your shoes or being able to zip your coat, but those are important things for families to be able to see.
A lot of times all the parents come in and feel like they don't understand their child, they don't know why they're doing what they're doing. And a great part of my job is being able to help that parent see that they really do understand their child and they do read them. Just because their child isn't using words doesn't mean they're not talking to them.
I have seen kids that are older than Carolee is and are doing way less than what she is. And I do know for a fact that some of those kids that are older did not have therapies at a young age. And I think that if they had that work and had those connections made when they were young, they would be further along in their progress.
I think our treatment has changed families' lives, and in sometimes not, in a grandiose way that the child is a completely different child, but yet that they're able to do the everyday things that other kids can do that we all take for granted.
For a lot of children who come here, there's really no cure for the diagnosis that they have. But there are parts of a lot of the diagnoses that we can have a positive impact on. We send people to a lot of courses every year for continuing education to make sure that we stay on the cutting edge of what's available for children. We actually have people from all three disciplines involved in hippotherapy, which is therapy on a horse. We do that out at Miracles in Motion, and we have different sessions throughout the year. And we're getting tremendous results. I've never known a kid who went through hippotherapy that just didn't think it was the best thing in the whole wide world.
There was many months there at the beginning where I was just lost. I didn't know what to do. And looking at so many things on the internet, you have so much going on. You don't know what's good, what's bad therapy. Over the course of being at Witwer, we hardly see any meltdowns anymore. His speech is expanding now. He's reading, taught himself how to read and write at age 5. It's pretty good. He's just improving in so many different ways. He's just becoming a very independent little boy.
I would say the biggest impact now since we've been to the Witwer Center has been her ability to be around other kids. She's been able to go to school half days. She's been able to be with friends on the playground and have lunch with friends.
We really want physicians to know that we want to be their partners in care. We want to augment what happens in their offices, and we want them to rely on us to help with the day-to-day, the week-to-week, the month-to-month work that needs to go on for kids who are having some developmental challenges.
These are things that in a child's developing life, if you catch them at the right time, you have the chance of making such a difference. Whereas if you wait too long, you might have lost that opportunity.
I wouldn't trade these people for the world. They care so much about our kids, and I can't say enough good things about them.
When we first started our journey and Simeon couldn't talk, I just remember thinking, I just want him to say, I love you, Mom. And he can. And he got invited to his first birthday party.
Don't give up, keep going forward. Look at all the resources around you, ask questions.
The earlier you can start intervening on your child's behalf, the better it's going to be for them in the future. But don't wait.
If you know of a child who could benefit from individualized therapy, contact a professional at St. Luke's Witwer Children's Therapy for more information.
Just knowing that we have something like this, she can come here, learn, do better, know that there is a light at the end of the tunnel. It's a miracle. It really is.
I feel what we have here at Witwer Children's Center is second to none.